I teach, and one of the things I often tell my youngsters is that mental health, physical health, and poverty are an iron triangle. If you have any two of those three, you're going to end up with the other. So that if you're sick and you're poor, you'll probably end up with mental health problems. If your mental health is poor and your finances are poor, you'll probably end up sick. These things run together. And if I could do one thing to change that would improve healthcare in America, that would be the most important thing to do, it would be probably to eliminate poverty. The elimination of poverty would probably do more to lift up America's health than any other single thing that we could do. Almost every day in my office I see a near miss where somebody who's uninsured could be in real trouble had they not stumbled into our office, and we give charity care and would get that person connected in a way to the care they needed. Probably once a month or so I see somebody wounded. Often they end up in the hospital on our teaching services in an advanced stage of illness where we can maybe recover some of the health that they have. You know, a typical thing would be someone who has a stroke from lack of care for high blood pressure due to lack of insurance. And every once in a while, like this young man I talked about who died from sleep apnea, we see a death. Now we know that in America, at this point, over 45,000 Americans probably die every year from lack of health insurance alone. That's a World Trade Center every couple of weeks. That's the sort of number of deaths that we're talking about, and that doesn't count, that's the deaths, that doesn't count the suffering and the disability and the economic disruption that goes along with the bankruptcies that are happening from our bills. I mean, we're creating poverty. We were talking about poverty before. We're creating poverty because people end up going bankrupt from the medical bills they're facing. So that's not a healthcare system, that's a sickness care non-system, and it's not a system of care and comfort, it's a system that creates suffering, and it needs to be changed.